Hey everyone, it's Cass from Dermetel, and today we are going over the basics of basal cell carcinoma. Basal cell carcinoma accounts for 80% of all non-melanoma skin cancers, making it the most common form of all skin cancer. In just the United States alone, over 2 million cases of BCC are diagnosed each year. Because it's so common and is diagnosed so frequently, it is good to know the warning signs and how to prevent yourself from getting it. So, let's go over the basics. Exposure to ultraviolet radiation is the major cause of BCC. The timing, pattern, and amount of exposure to ultraviolet radiation is important, and the risk of getting BCC increases when skin damage has been done during childhood and adolescence. As UV radiation hits your skin, it damages DNA in your skin cells, and eventually, over time, cancer can form from the damage. Basal cell carcinoma doesn't just have one look. In the beginning, you may notice a small bump that looks like a flesh-colored pimple or mole that just won't leave. Sometimes it shows itself in the form of a pink or red scaly patch. Other times, it can manifest itself as a waxy, hard growth. But while these symptoms vary, one thing that these variations all have in common is that many times the spot or area will bleed easily. If you notice any of these symptoms above or notice any changes in your skin at all, make sure to visit your doctor for a skin cancer screening. If your doctor believes that there's something to check out, he will take or have a biopsy taken of the area, meaning he will take a sample of the growth or patch and have it tested for cancer cells. If you are diagnosed with basal cell carcinoma early enough, fortunately it is very curable. Sometimes all it takes is cutting out the growth or area, but if the cancer has spread, other treatments will be needed. A doctor using a curette to scrape off tumor and then killing any cancer cells with an electric needle, or Mohs surgery, the leading type of surgery for skin cancer. Other treatments include radiation therapy, chemotherapy, and more. Your treatment will depend on how far the cancer has spread and when it was caught. Preventative action is something we stress many times in these posts. But skin cancer is so preventable, so it's good to take precautions to avoid a first, second, or even third time diagnosis. Do self-skin checks every month, especially if you've used tanning beds, tan frequently, or have not used sunscreen in the past. By taking these steps now, you may not have to worry in the future about a skin cancer diagnosis. Thanks for watching, guys, and we'll see you next time.